LADC Certification Practice Test 2026, Licensed Alcohol and Drug Counselor. All you need to know. Question 1. A client enters with visual signs of withdrawal, including significant nausea and agitation, and mentions thoughts of self-harm. What is the most appropriate initial reaction? Attempt to calm the client and begin a full assessment. Alert the client's emergency contacts immediately. Seek immediate medical attention for the client. Administer a mild sedative if available. Signs of severe withdrawal combined with suicidal ideation constitute a medical emergency requiring immediate professional intervention. Question 2. Which of the following is not typically a factor assessed when determining suicide risk in a substance abuse client? History of alcohol abuse, family history of suicide, evidence of aggression towards others, the client's current employment status. While employment can be a stressor, the other options, SUD history, family history, and aggression, are primary clinical risk factors for suicide. Question 3. Which drug testing method is generally considered inappropriate for monitoring regular compliance due to its long detection window? Urine, hair, saliva, sweat. Hair testing has a very long detection window, up to 90 days, making it unsuitable for tracking short-term, day-to-day compliance. Question 4. How long does alcohol typically stay in the body's system after ingestion for standard testing purposes? A few hours, 12 to 24 hours, 1 to 3 days, about a week. Alcohol is metabolized quickly, usually leaving the system within a few hours depending on the amount consumed. Question 5. Which of the following substances is most likely to cause a false positive for opioids on a standard drug screen? Doxylamine, poppy seeds, sesame seeds, sertraline. Poppy seeds contain trace amounts of morphine and codeine, which can trigger a positive result on opioid screens. Question 6. In the assessment of co-occurring disorders, which role is typically outside the scope of an addiction counselor's standard practice? Screening for co-occurring disorders, determining the severity of the substance disorder, formally diagnosing the specific mental health disorder, determining the effect of the disability on substance use. Addiction counselors screen for mental health issues but usually refer the client to a psychiatrist or licensed psychologist for a formal mental health diagnosis. Question 7. According to DSM-5 criteria, if a client exhibits 5 out of the 11 criteria for a substance use disorder, SUD, what is the severity level? Mild, moderate, severe, provisional. DSM-5 defines SUD severity as mild, 2 to 3 criteria, moderate, 4 to 5 criteria, and severe, 6 or more criteria. Question 8. Which substance's withdrawal is most frequently associated with symptoms like elevated blood pressure, severe agitation, and potential seizures? Cocaine, alcohol, marijuana, LSD. Alcohol withdrawal, especially delirium tremens, involves significant autonomic hyperactivity, including hypertension and seizures. Question 9. Long-term damage to memory and the ability to concentrate is most strongly associated with the chronic abuse of which substance? Amphetamines, heroin, psilocybin, caffeine. Chronic amphetamine use is linked to neurotoxicity that can impair cognitive functions like memory and concentration. Question 10. All of the following are part of the CAGE screening tool except: have you felt the need to cut down? Have people annoyed you by criticizing your use? Have you ever experienced delirium tremens? Have you ever used an eye-opener in the morning? CAGE stands for cut down, annoyed, guilty, and eye-opener. Delirium tremens is a withdrawal symptom, not a CAGE question. Question 11. Which of the following drugs is classified as a benzodiazepine rather than a stimulant? Adderall, methamphetamine, Xanax, Ritalin. Xanax, alprazolam, is a benzodiazepine, depressant. The others are CNS stimulants. Question 12. In the stages of change model, a client who is aware a problem exists but is not yet ready to make a commitment to action is in which stage? Pre-contemplation, contemplation, preparation, maintenance. Contemplation is the stage where the individual recognizes the problem and considers change but is ambivalent. Question 13. To be effective, treatment plan objectives should ideally be lengthy and detailed, generic and applicable to all clients, collaborative and measurable, determined solely by the counselor. Effective objectives follow SMART principles and should be developed collaboratively with the client to ensure engagement. Question 14. At what point in the treatment process should case management services ideally begin? Only after the client has achieved 30 days of sobriety, during the discharge planning phase, at the point of first contact or intake, when the client specifically requests it. Case management begins at intake to coordinate care and address immediate needs that might hinder treatment success. Question 15. What is the primary neurotransmitter involved in the reward pathway that is targeted by most drugs of abuse? Serotonin, dopamine, GABA, acetylcholine. Dopamine is the key neurotransmitter in the brain's reward system, reinforcing behaviors by producing feelings of pleasure. Question 16. The moral model of addiction posits that substance use disorders are caused by a lack of willpower or a character flaw, genetic predisposition, environmental stressors, brain chemistry imbalances. The moral model views addiction as a personal choice or character failure rather than a disease or biological condition. Question 17. Which approach is specifically designed to reduce the negative consequences of drug use rather than requiring immediate abstinence? Contingency management, harm reduction, 12-step facilitation, cognitive behavioral therapy. Harm reduction focuses on minimizing the harmful effects of substance use, example, needle exchanges, for those not yet ready for abstinence. Question 18. In motivational interviewing, what is the primary goal of the counselor? To confront the client's denial, to provide expert advice on how to stop using, to enhance the client's internal motivation to change, to document the client's failures. Motivational interviewing is a client-centered, directive method for enhancing intrinsic motivation by exploring and resolving ambivalence. Question 19. What does the term dual diagnosis refer to in addiction counseling? A client who is addicted to two different substances, a client having both a substance use disorder and a co-occurring mental health disorder, a client who has relapsed twice, a diagnosis confirmed by two different doctors. Dual diagnosis, or co-occurring disorders, describes the presence of both a SUD and a psychiatric disorder. Question 20. Which model of case management focuses on identifying and utilizing the client's existing assets rather than their deficits? Broker/generalist model, clinical/rehabilitation model, strengths-based model, assertive community treatment. The strengths-based model empowers clients by focusing on their internal and external resources and abilities.